Hello, 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 and welcome to the Get Your Guide Coaching Podcast. This is a special podcast, and I know I say that for most of my podcast episodes, but this one I think is really important, especially for me and so many Black women out there. Today, we're going to be talking all about fibroids. This is something that has plagued so many of my family members, my clients, and I want to make sure that you all are as informed as possible as it pertains to fibroids since it's so prevalent in our community. And so I had to bring a special guest here today to talk all about it. So most of this episode, I'm probably going to shut the hell up and I'm going to let him talk, Dr. Mikhail. I want to introduce you to my listeners. Listeners, I want to introduce you to Doctor. He knows so much about fibroids. I found him on TikTok. I said, I have to have this person on my show. And welcome, welcome, welcome.
Thank you. Thank you, Coach Anwar. I'm privileged and super grateful to be here and to add value and to absolutely serve your community. So thank you for the opportunity.
Of course. Now let's get into it. Let's start by first just starting to explain a little bit about what fibroids are and why so many women don't even know that they have them until they're diagnosed, or I think oftentimes we were talking before when they get pregnant or are trying to get pregnant.
Exactly, exactly. So first of all, we'll sort of start at the high level. So what are fibroids? So fibroids are benign muscular tumors that occur in and throughout the uterus. The word benign basically means not cancer. And that's an important distinction because many women are under the impression that somehow their fibroids may be related to cancer. They're not. Okay. So that's the first thing. The second piece is they're made out of muscle. So if I was to take, your bicep, and you cut it in half, fillet it like a grapefruit, and I was to do the same thing for a fibroid and looked at them both under a microscope, they would both have muscle tissue. And why is that important? That'll be very important when we start talking about treatment options and why fibroids respond the way they do and why they provoke certain symptoms. So very important. So when it comes to fibroids, the most important thing to understand is their epidemiology. So fibroids are extremely common. If you were to look at all comers in terms of just women everywhere across the globe, the number is around 70%. So in that seven that have fibroids, there's usually going to be three of them that just don't know that anything is wrong. They're just blissfully living. And so the next point is now, well, when do usually women sort of end up identifying that they actually have this issue? When do fibroids sort of declare themselves? And this is sort of the tricky piece. So you mentioned pregnancy. So pregnancy is an unusual time, right? And usually at this particular time, fibroids may be seen. Okay, and people may say, well, Dr. Higgins, why did I not have symptoms before? I started actually, not only did they see these fibroids during pregnancy, but then they grew so quickly, and they saw this in real time where it doubled in size or tripled in size, and that has to do with some of the triggers for fibroids. One of which is estrogen. Estrogen is like fertilizer for fibroids, and we
Okay.
know that estrogen is secreted by the placenta, and so it sort of starts surging sort of the estrogen secretion, and it's like a growth spurt for the fibroids. And what ends up happening
Mhm.
is something that's very troubling, which is that now there's a competition between the little sort of impressionable fetus, very soft and lovey, and then there's the fibroids, which are sort of very hard and sturdy, and oftentimes there can be miscarriages, very, very, very unfortunate miscarriages. But the other times when, of course, there aren't miscarriages, 40% of the time, they're going to be pregnancy complications, ranging from preterm labor to a condition called abruption of the placenta, where the placenta can peel off and threaten hemorrhage for both the mother or the baby. Or you can have a situation where the child is now getting ready, to sort of, enter this world, but its buttocks is facing towards the vagina, which is not the way it should be delivered vaginally. And there's no way for it to turn around because the fibroids have become so bulky where it can't even turn. And so what that means is now a cesarean section has to result. And unfortunately, many women get cesarean sections, and it's gotten to the point where it's so common where it's been normalized. It's not normal. Women should not be getting cesarean sections. And this sort of is what sort of happens during this particular time. And then the fourth thing is, of course, now you can have issues where, again, preterm labor, which now puts the child at risk for obviously, prematurity and everything that goes along with that. But think about sort of women in general in terms of sort of, going about their daily lives. One of the reasons why I think that 70% may or may not know that they have fibroids is the fact that the symptoms for fibroids occur very slowly over time, right? They say that if you boil a frog, it'll never jump out, right? Why? Because it sort of gets
Right.
adapted to the water. It feels a little warm, a little warm, a little warmer. Before you know it, the frog is boiled. Okay. So similarly, a woman may start having every month, I'm using 3 pads a day during my heavy days. The following year, it's 4 pads. The following year, it's 5 pads. The following year, 6 pads. And so over time, they're up to 10 pads. You're like, how did you get to 10 pads? Well, I started at 3, right? But now, a decade in now, the women are like, well, this is just me. I just have heavy periods. And I think that is one of the things, that I want to sort of say just by starting out. Never allow symptoms to be your identity. Never say, I just have heavy periods, right? Because that may be you making an excuse, and I'm talking to your listeners here, for the fibroid symptoms. Okay. Never say, okay, you know what, maybe a year ago I used to enjoy intercourse with my partner, but now I just not feeling it. It's just a little painful. Certain positions, I used to like them. I don't like them anymore. No, never say, well, I used to wake up one time in the middle of the night to urinate, but now it's two, and now it seems to be three. Never really still have to walk out of meetings, our little sort of weekly meetings, but now I feel like I have to go to the bathroom at least one time. I used to use the bathroom daily, but now it's every other day, and actually now it's every 3 days. So when you start seeing these symptoms slowly sort of ramp up over time, there has to be sort of this sort of pause to say, you know what, this wasn't normal a year ago, this wasn't normal 2 years ago, maybe I should do something about it. And that
Yeah.
is the most important thing I want to start by telling your listeners today. It's not a matter
Thank
of
you for
if,
sharing
it's a
that.
matter of when.
Yeah. Well, you had said something in our pre-meeting that gagged me, which
Mhm.
was that 1 out of 4 women will develop fibroids by 30, but that number jumps up to 8 or 9 women out of 10 by the age of 50. You talked a little bit about some of these habits that change over time. If there's anything else that like women should be getting screened for, that's really important. And then secondarily, I wanted to ask you, why is this so prevalent in the Black community?
Yeah, no, so great question, Coach Anwar. The 1 in 4, 1 in 4 Black women by the age of 30 will develop fibroids. So again, that's 25%, as you mentioned. And that number jumps to 80% in Black women. But again, all comers is 70%. If you look at white women, people say, well, white women don't really develop fibroids. No, no, the number is closer to 50 to 60%, right? If you look at Asian women, number is closer to 23%. If you look at Latinas, between 46%. So it is a large number of each ethnicity, okay? But you asked a very, very important question. So some people think that this is like a Black woman problem. So here's why many women are predisposed, but specifically Black women. So the question that I usually get is, well, why do fibroids develop? And that is the most important question. It is because of genes. Okay, we know that there are different parts of the gene, which we call the genetic loci. It's sort of parts of the structure. If you think of sort of a program, it's sort of the coding for that particular program will predispose women to developing fibroids. Whether Black women or white women have more or less of these loci, the jury is sort of out on that. But what we will say is that once a woman has a predisposition, i.e., in this case, we're talking about Black women, it's going to happen again. It's not a matter of if, it's a matter of when. Okay.
I think
Now,
that's a really important point that I just want my listeners to understand. It's not an if, it's a when. Yeah, thank you so much for saying that.
yeah, yeah. In the case of Black women tend to develop periods at an early age than white women. We call that menarche.
Hmm.
So, what happens when a period develops? This is when now the cycling of certain women hormones, female hormones, estrogen and progesterone begins. Estrogen is like fertilizer for fibroids. It's like pixie dust. You sprinkle some estrogen on fibroids, it's going to surge, it's going to grow. Now, if you think about the duration of periods for a white woman versus a Black woman, now again, from the first time they've had a period, maybe that is 12 years of age for a white woman. Maybe for a Black woman, that's 8 years. So they're going to have a longer exposure, the Black woman, to these peaking and troughing of estrogen levels in their body, which
Hmm.
means that they're going to have a longer time for the estrogen to essentially give rise to fibroids. Okay. So that is the first thing. The second thing is, unfortunately, in the case of Black women, they have a higher rate of obesity. Okay. So what does that do to this predisposition for fibroids? So the first thing is, where is estrogen secreted from? Estrogen is secreted from 4 main sites. The first site is the ovary. Okay. The ovary is the reproductive hormones and organ in women. The second site is the adrenal gland. The adrenal glands are sort of little endocrine glands that sit atop the kidney. They're famous for secreting the stress hormone, cortisol. They're also famous for secreting the fight or flight or freeze hormone, adrenaline. Okay, but they also secrete estrogen. So we have the ovaries, we have the adrenal glands. The third site is the site that we talked about before, which is the placenta. So, which is why many women go throughout their daily lives, and it isn't until they become pregnant where they're like, geez, how did I just find out I have fibroids during pregnancy. This is an inopportune time, but it's because the placenta is secreting estrogen at a very high rate. Okay, so we have the ovaries, we have the adrenal glands, and we have the placenta. Now, the foresight is what people never talk about, and mum is often the word, and it's adipose tissue. And adipose tissue, aka fat cells. If you are obese, you have more fat cells than the other person now who has less. And so what that means is that you have higher circulating estrogen. So if you think about an obese black woman, she is going to have higher circulating estrogen, which is going to be more fertilizer for now, obviously, the fibers to develop, okay, in her body. So that is a high predisposing factor when you compare that factor in case of obesity in black women to sort of less incidence of obesity in white women. The other thing is, of course, women who are obese tend to have diets that match their obesity, right? So they may consume things like red meat, they may consume things like processed foods. They may consume things like sugars and things that are pro inflammatory that will predispose them also to fibroids because of the pro inflammatory nature, right? So not only do they have higher rates of obesity, more estrogen, but now they have the diet, the lifestyle that matches that. What also do women that are obese do less of? They may exercise less, right? And what the studies show is a highly protective factor for fibroid growth is exercise. Next point I'll say is, well, if you look at a black woman and a white woman, it's obvious the differences in their skin complexion. Well, what gives that skin complexion? It's melanin. So what does
Melanin.
melanin do, and how does melanin play in this process? Well, many black women have a deficiency in vitamin D. So what that means is that black women have to stay in the sun longer to be exposed to ultraviolet light in order to absorb more of it than white women. So what does that do to vitamin D levels? It decreases your ability to synthesize vitamin D. Now, what does vitamin D do in the case of fibroids? Well, what people don't know is that vitamin D has a secret role other than calcium absorption. What it does, it actually helps with hormonal regulation. Oh, wow, that's a new thing. The other thing it does is it actually helps promote an anti-inflammatory environment. Wow, okay. But what it also does is it actually promotes something called apoptosis. What is apoptosis? Apoptosis is where it gives a signal to bad cells in the body to basically commit suicide. It basically signals to them to just basically implode. What you want is you want that vitamin D present because it will tell the fibroid cells implode, 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 implode. And so if you think about now the sort of genetic predisposition, you think about the environmental and lifestyle predisposition, and now obviously things that are chemical that now are being sort of taken into our bodies that we may not know about it. These are all factors that predispose black women to developing fibroids in comparison to their other ethnic counterparts.
Yeah, thank you. So what I heard was genes, I
Yes.
heard obesity, I heard vitamin D deficiency and slash melanin, and then I heard hair relaxers as environmental factors around fibroids. Did I get all of that?
Yep, yep, yep,
Okay,
exactly.
perfect. I just want to also summarize for my listeners too. Earlier, you talked a little bit about like the progression and how fibroids affect the quality of life, whether it's more pads or more bathrooms or less bathrooms or breaks. Are there other warning signs that we should not be ignoring here?
So the fibroids affect women in two main ways. One in terms of menstrual symptoms, and two in terms of bulk symptoms. So let's unpack the first one, right? So when fibroids grow, they grow by essentially hijacking the blood flow from the uterus, right? So there's two main sources of blood supply to the uterus that come from the heart. It's the uterine artery on the right side, uterine artery on the left side. Okay, now the fibroids hijack that and create almost like a spider web, right? And they have their little colony of fibroids that grow and develop over time, kind of like grapes on a vine. Okay, but they
Mhm.
almost like the vine enters the ground at these 2 points, they enter the bloodstream and they suck the blood from the uterus in order to feed the entire sort of colony of fibroids.
Like a
Okay, so
parasite almost.
exactly, they're very parasitic. Now, what that means is that you and I and every woman in your community has a certain production capacity of red blood cells. Okay, what do red blood cells do? They go to the lungs as you take a deep breath in, that oxygen diffuses into that red blood cell, and then those red blood cells go and travel through the bloodstream to your muscles, to your spleen, to your kidneys, to your adrenal glands, to your liver, in order to give oxygen to those organs and tissues. Okay. Now, the production capacity is what it is. It's not going to increase itself. Okay. Now, what happens is when these fibers are now taking blood, taking oxygen carrying capacity, there's less of it to go around. So what that means is that what many women may notice is they start noticing that there's a decrease in energy over time, very slowly.
Because I just want to get clear here because I think just generally getting older, we might feel less energetic, right? So how can we make the differentiation between age and then this?
Yes, yes, yes. But see, this is the tricky piece, right? So we're talking about warning signs, okay?
Hmm.
You know, you know, I feel much better now than I felt 10 years ago because of my lifestyle. Okay. So this point about, as a yogi, as a yoga instructor, one of the things that we learn is that, aging is normal. Getting old is not okay. So you shouldn't be thinking that, oh, this is just old age, right? This is just an excuse for maybe something that's lifestyle related that was preventable. Okay. So again, back to the point, it's not a matter of if, it's a matter of when. So if you're doing everything you've been doing and you are getting tired, okay, right, and people around you may not be, the question is, well, why are you, what are you doing that's sort of actually leading to this? And the question is, you're not doing anything. There's something, as astutely noted, it's parasitic, that is stealing your thunder. Okay. It's making it very difficult for you to do what you need to do. And so what you start doing is you start adapting your lifestyle to it. If you start noticing that you're walking upstairs and you're taking deep breaths in, or you start noticing that your heart is beating a little faster when you're walking to the parking lot, it is because your body is trying to compensate for the blood loss in the form of these fibers that are sort of tapping your blood on a daily
Hmm.
basis. Okay. So that energy thing is the thing. The second thing is you start noticing that, okay, you know what, actually you're getting a little lightheaded here and there. Okay. Many women say, oh, well, it's because of my period, or some women say, oh, I'm anemic. Okay, well, the question is, I've heard women who told me that they've been anemic for years and they've never gotten screened for fibroids. I'm like, well, why do you think you're anemic? You're anemic because you're losing more blood than your body is making, which will suggest that maybe there's some lack of equilibrium that something is contributing to, and i.e. the fibroids. If you're a black woman, you're maybe in that 80%. There should be a sense of suspicion that this could be happening, right? Now you move to the other side and you talk about bulk symptoms. If you are working out, I had a physical trainer, who I treated coming on a year now, and she looks amazing. But what's so cute is that you would see her working out and you think she's 3 months pregnant working out. You're like, oh my goodness, she's a beast. No, she's not she's a beast, but not because she's pregnant and working out. It's because she's fibroids. And that's why her stomach looks like it is look. But she's looked like that for the previous 2 years, right? So if you're working out and you're noticing that there's a part of you in your little tummy that you're like feeling and it feels hard, like, okay, well, maybe there's something inside you that's growing. If you're noticing that, okay, you know what, in the past, you used to very much enjoy, intercourse with your partner, and somehow it's gotten less pleasurable and actually turned into more painful. Something is happening, right, that is causing these changes to occur. And again, there needs to be a level of suspicion. There needs to be a level of consideration that this is something that could be attributing to the fact that you're becoming more painful with intercourse, the fact that maybe, oh, wow, like, well, I know I've heard the statistic that, 1 in 5 to 1 in 10 women are going to have miscarriages at some point. Well, if you've had 2 and 3 miscarriages, maybe you should start thinking about fibroids. If you're now working out and somehow you feel, more bloated, and than you did a year ago, and you're still working out, then you should be considering. If you're now thinking that, okay, you know what, you're doing all these things, you're working out, but you're still getting lightheaded, or you're still huffing and puffing when you go upstairs, it's not. As one, patient told me last week, I just feel like I'm lazy. No, 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 you're not lazy. There's something that's happening inside you. And that woman had a 9 centimeter fibroid that she just found that she had. So what I say this, that as these symptoms continue to worsen, don't make an excuse for them. Okay. Just try to explore and be
Get
curious.
curious.
Yeah,
Yeah, get
exactly.
curious. And I
Exactly.
just want to add too, just from a dating coach's perspective, that oftentimes I will talk with my clients and they will say, you know, I don't even want them to touch me, right? I don't want them, and we explore it, and it's like, actually, I haven't really been enjoying sex
Exactly.
intimacy recently.
Exactly.
And for many of my clients, it's because they find out either then or later on that it's a fibroid issue as
Exactly.
well. So I just want to share that because I think it's really important. The other thing that I just wanted to share too is I know a lot of you smart schoolgirls out there are like, I don't understand why these men are trying to tell us about women's health. I just want to offer to everyone that's listening that we can't change our gender, but we do care about you and we love you and we want the best for you. And that's why we're having this conversation. As you can tell, this is different than many of my other podcasts. It's very informational. There's a lot of science in it as well. But I needed to have Doctor on because I want you all to be safe and we love you. So I just wanted to share that too, because, some people might feel that, think that about women's health. And, you know, we want the best for you. We want you healthy. We want you thriving. And that's why we're having this conversation. And that's the intention of this episode. So with that said, let's talk about treatment options because I know that sometimes it can be really hard, especially for Black women, to not hard, but there's difficulty in the medical system and advocating for oneself. So I do think it's important for them to have as much information as possible about treatment options here.
Yeah, no, I appreciate that, Coach Omar. So let me also let you know what I'm grateful for. What you just said, I think, is something that I just want to kind of hold space for. I think many women go to female doctors because they feel like there's going to be a sense of sort of shared experience, a sense of sort of this like a more authentic sense of empathy with their female doctor, their gynecologist, their internist, as relates to these particular issues. Absolutely understand that, and I many of my patients prior to coming to me would have said to me that is exactly why they chose the physician that they chose. I will say this, for me, I am so committed to this work. Why? Because I feel that many women, particularly Black women, are not seen, they're not understood, and this issue is not taken as seriously as it is. Many women are dismissed. They're told that their fibroids are too small. They don't need to do anything about it. They just need to be placed on oral contraceptives. And then when the time comes, 5, 10 years later, when they want to get pregnant, now they realize it's quadrupled in size. And now they're like, well, you didn't tell me that this was going to contribute to the growth, or that while I didn't have these symptoms, that they were still growing inside me. Now it's time to get pregnant. And you're telling me I need a surgery. So being able to sort of understand the sort of silent suffering and the confusion, the dilemmas that women sort of experience, and particularly Black women, which we'll sort of transition into soon when we start talking about treatment, is something that I'm so committed to. This is my purpose in life. And so I want to sort of, say that, your point, I think, is very well taken. And I just want women to know that we are absolutely in your corner, which is obviously why both of us are on this call today. So that being said, so what are the treatment options? There are four that I'll discuss. Number one is a hysterectomy. A hysterectomy for me is like throwing the baby out with the bathwater. That is like taking your uterus to your doctor and you say you have a fibroid problem. They say, you know what, let's throw this uterus in the garbage. Okay. And it gets to the point where it's so
So
normalized.
extreme.
The
Yeah.
number one reason for women using their uterus is not cancer or anything like that. It's because of fibroids. It, for me, is so drastic, right? But here's the issue that I have a greater problem with. The second reason I abhor hysterectomy is because of why not all women are treated the same. Up to 5 times Black women are offered hysterectomy when compared to white women as an option to treat their fibroids. 80% is not 5 times more than 50 to 60% in the case of white women. Why people feel more comfortable offering a sterilizing procedure for one ethnic group versus another. Okay, so we'll put that there. But the third reason I dislike hysterectomies is the following. 20 years, 25 years ago, many of us can remember if you were to go into any of the convenience stores, the pharmacies, and you were to look up at Depends, the undergarments, right? They would have pictures of old people on it. Okay, right? Why? Because old people are, people say, oh, well, maybe they can't control the ability to urinate or whatever it is. But who's on them now? Young Black women. Okay, and
Mm.
nobody asks, well, why is that the case? Well, it's because of if Black women are getting hysterectomies more often than everybody else in their 20s and their 30s, then they're going to have the major complication of hysterectomy, which is what? Urinary incontinence. So what's urinary incontinence? Urinary incontinence is where you take a deep breath in, you hold it, a little bit of urine seeps out uncontrollably. If you cough, urine seeps out. If you sneeze, urine seeps out. Okay. Is there a treatment for it? No, right? Because it is a surgical complication of hysterectomy. What is the way you manage it? You live with it by what? Using Depends. It's to the point whereby this particular market is what it's seen as, is these women with complications where they can't control the ability to urinate. It's gotten to a point where now it's created a whole sort of viable market for this company where they don't even have to advertise to old people anymore because their new market are women in their 20s and 30s and 40s who they want to normalize wearing Depends. Okay, that's the issue I have with hysterectomy. The second option is what we call an open myomectomy. An open myomectomy is where you make a gynecologist will make a sort of incision about yay big, and then they go in and they attempt to pluck out the individual fibroids. Okay, so When fibroids occur, they occur almost like peanuts in a Snickers bar, okay, all over. If I was to ask you, Coach Anwar, please remove all of the peanuts from this Snickers bar, but I need you to keep the caramel and the chocolate intact, you look at me like I'm crazy. But that is the
Hmm.
task of a surgeon to go in there. You want to get pregnant again, and they want to keep the structural integrity of your fallopian tubes, of your womb intact, while they're literally removing the fibers that have no. They're like fibers without borders. They don't care where they go. Okay, they don't care
Right.
if they're in the fallopian tube, outside, pressing on it, but they have to remove these. So what the surgeon is trying to do is remove that as safely as possible, right? And it is almost an impossible task, which is why what 2 to 3 years later, many women come back and say, "I start having symptoms again." Disclaimer is that ultrasound has a blind spot. Ultrasound will not identify all the fibroids. Okay, that's the first thing. So now they've
Mm.
identified seven, eight. What the surgeon needs to do is to make sure that he or she removes more than what the ultrasound noted, the main ones that were seen. If he or she leaves less than the total number, then it's not obviously going to affect you because you didn't know that there were these more. So their whole goal is to do what? To remove the main fibers that are causing problems, which they do very, very well. Their goal is to not do anything to compromise the structural integrity of the uterus so that you are not able to have children in the future. They do that very, very, very well. But what their sort of, the issue is that they're not able to remove all the fibroids all the time. Okay. So the recurrence rate obviously is something that women struggle with. The third option is a robotic or laparoscopic myomectomy. What that is that for women who say, you know what, I don't like the 6 to 12 weeks that I was off from work with this open myomectomy before, I need something that's going to get me back to work in a week or two. Now, when you compare robotic or laparoscopic to open, where is the discrepancy? It is in the fact that robotic or laparoscopic procedures have a higher recurrence rate. What does that mean? That means that if it took you 3 years to develop new symptoms with the open, you're probably going to develop it less. I had a lady from Brazil. She came to see me in December. She went back to married to a Bahamian guy. She went back to Brazil to get surgery, a robotic one. 6 months later, she had recurrence of symptoms. And I said, this is a perfect example. Instead of 3 years, 4 years for recurrence, maybe, for the average woman that steps in my office in the case of open myomectomy, she had 6 month recurrence, literally came back within 6 months. Why? And she said, well, why is that? I said, well, if you imagine, the little tiny incisions that are obviously being made, what is the surgeon not able to? They're not able to touch the uterus. If you send a blind surgeon there, the blind surgeon would probably do a good job if he or she could say, okay, this is normal tissue, this is not cut hair. Normal tissue, not cut hair. But the surgeon who has, the instruments outside the body going through little tiny incisions can't do that. So if they don't see it, they're not going to cut. So what that
Got it.
means is the chance of having less obviously removed and the chance of having more left behind. Okay. So the fourth
Okay.
option is what I offer, which is called a uterine fibroid embolization. What is that? This is a minimally invasive non-surgical technique where I go in through a little 2 millimeter incision in the groin through the common femoral artery, and I navigate using a catheter and a wire, watching live x-ray over the body, and I find that precise point where the fibers have hijacked the blood supply from the uterus. And I go into that spider web we talked about, and I block off every single branch of the conglomerate. So if the fibers are the size of sunflower seeds, size of grapes or peanuts that are probably going to be missed by the ultrasound, they get treated. If they're the size of watermelons or cantaloupes, they
So when
all.
you say treat it, what does it mean? Do you mean like you cover it like a blanket and you suffocate it, or what
No,
is that? What
no,
does that
no.
mean?
So I drown it from the inside. Okay, using little salt-like crystals that basically I'm using to push with the blood flow into each of the tips of these branches. And as it continues to back up, back up, back up, back up, back up, back up, back up to the point that the fibers have hijacked the blood supply from, I basically drown it from the inside. And what we know is once
Okay.
that happens, the entire conglomerate dies. And so many women say to me, what happens to the fibers when you treat them? Amazing question. Remember I said they're made out of muscle? So people never ask, well, where did the muscles go? They were metabolized by the body. So when the body wants energy, what does it do first? It goes to the last meal and it tries to find the starch and the carbohydrates in the last meal. What is the next thing it does? It goes for fat, starts burning the fat. But the third thing it does is it attacks muscle. If you have a treated fibroid that now is not attacking you and sucking from you anymore, it is the best source of protein for the body. The body breaks it down. Okay. And so my patients, not only do they lose on average 12 to 22 pounds in the first 4 weeks, what they also notice is even after that first month, when the periods have all normalized and they're not waking up to go to the bathroom anymore, and now they can have relations with their partner. And months later, they're noticing the energy levels continue to go up. Why? And they're like, why do I feel like a freaking rocket? It's because of the fact that the body's continuing to act on the fibers to break it down. And so as you notice, in these particular cases, these women are now going to have, the periods are obviously that they had, heavy ones are going to normalize. The ability to have intercourse, pain-free is going to obviously, completely disappear as a symptom. The, waking up in the middle of the night to urinate is no longer going to be an issue. Miscarriages are going to obviously decrease. And the whole sort of quality of life is now going to level up. The final point I'll make is that, many women say, well, Dr. Higgins, well, why didn't my gynecologist tell me about this? And that is a tricky question when I'm posed. And it
Okay.
has to do with the fact that I'm an interventional radiologist. I'm not a gynecologist. And many persons on this call never heard of that. Why? Because we are an endangered species of specialty. We are the newest specialty in medicine. And a few years ago, we were considered the most difficult and competitive specialty to get into. We also do, I can treat strokes, I can treat pulmonary emboli, I can treat cancers in the kidney, I can treat cancers in the liver, I can treat knee osteoarthritis, membrane enlargement. I can do all these things. And so my field, my colleagues typically don't focus on fibroids, right? So UFE, although it is the most underutilized paradigm shifting treatment in medicine, it is something that the persons who can do it are few and far between. I have a colleague in Atlanta, in Alabama, showed a statistic the other day. She gave a talk. She showed that in the state of Alabama, there's really only two sites where you could get high level uterine fibroid embolism in the entire state. Okay. So if you think
Mm.
about the place that I focus on, which is the entire English speaking Caribbean now, when I came and I started doing this work in 2021, I was the first in my country, and there were only two of us in the entire English speaking Caribbean. So would somebody who's seen you mention this procedure? Probably not. And if they mention it, they're not going to know much about it. So they're going to discourage you from doing it because it's what? It's new. But is it really new? It was invented in 1974 in France. It was validated in 1995, 96. Who had it? Who was a famous person? Condoleezza Rice, right? In 2003, my colleague Jim Spees at Georgetown Medical Center treated her in November 2003 on a Friday, and Condoleezza Rice was back to the White House on a Monday. So if Condoleezza Rice knew about this treatment in 2003, after asking her advisors what was the best treatment for her, why can't you, your community, also be entitled to the same trust from a physician that obviously in the
Right.
business to offer that? And so I want to say that
Mm.
women should know their options. You can't do better
Yeah.
till you what know better. And this is why I'm just so grateful for you, Coach Anwar, for sending the elevator back down to these women in order to give them the information so that they can make an informed decision. So they're not told what to do in sort of a place where they may feel ignorant of what else is out there. Or like many women who come to me and say, wow, they message me on Instagram or TikTok and say, I wish you were around 10 years ago. I wish I heard about, well, this was around 10 years ago. You just weren't heard about it. And so what you're doing, I think, is just super important. And I'm just so grateful to have this platform to share with you and to educate your community on something that's so important to them.
Yeah, thank you so much, Dr. Mikhail Higgins. What you're doing is amazing, and I want to thank you for your work. And thank you so much for being here and sharing all of this information. Um, if people want to learn more, if they want to continue this conversation with you, how can they get in touch with you?
Yeah, so great question. They can reach me. They can certainly follow me on Instagram. We put out a lot of content on Mikhail Higgins, Mikhailhiggins on both TikTok as well as Instagram. And then you can also find me at the Bahamas Fibroid and Interventional Clinic on Facebook. You can follow our community there. And then certainly reaching out to me. And then we have our website, which is bahamasfibroidclinic.com. And so, I just want to say I am a warrior in this fight, right? I am
I
absolutely
know, that's why
determined.
you're here.
Oh my goodness. I have had relatives like you that have not been given all their options. And one of the worst places to be is to be in a place of regret when
Yeah.
you were not in a position to do otherwise, when you entrusted your care to someone who you felt would do better. And so it's just a privilege to be here and to speak to your community. So thank you so, so much.
Thank you, Dr. Mikhail. Ladies, I hope that this session was informative, that you learned something that maybe you didn't know before. Like I said before, we want you healthy, we want you safe, we want you thriving, and that is the intention of this episode. Again, thank you so much, Dr. Mikhail. And lady listeners, I will talk to you on the flip side. Bye bye.